My name is Lucia Harrison. I'm the founding chair of the Immigration Partnership. I still sit on council and the CEO of the Kitchener-Waterloo Multicultural Centre. Okay. The Immigration Partnership is a collaboration of over 110 people from 60 community service, municipal, business, post-secondary, and other organizations and individual residents who have been working together for over 10 years to empower immigrants and refugees to successfully settle, work, and belong, the three strategic pillars of our work. Since the partnership's inception, the Region of Waterloo has hosted the Immigration Partnership at the request of the community and has been very supportive and an engaged partner. Staff from across the region's community services, public health, human resources, and citizens service departments actively participate in the partnership. Staff and other regional departments lend a hand and support our work whenever requested. When the Syrian Resettlement Initiative was announced at the end of 2015, the partnership and the region came together to jointly coordinate a massive and acclaimed community response to the welcoming and settling of approximately 1,800 Syrians that made Waterloo Region their home. And together we oversaw the administration of over $800,000 in community donations to local programs that support the work. We learned through that process that in times of pressure, we work effectively and intentionally as a community to be successful in immigrant settlement. And we know that in times when the pressure is less obvious, we need to work with the same intention to make immigration successful in the immediate and long term for all of Waterloo Region. An example of the intentional work within this sector is we are actively exploring with the major settlement agencies in the creation of a settlement hub in Waterloo Region to improve and make more effective the work that we do with immigrants and refugees. Canada is growing immigration levels every year because immigration matters to communities across the country. Waterloo Region is no exception. Everyone has a role to play in making sure that immigration works in communities and that the mutual benefits to communities and to immigrants are fully leveraged. Municipalities play a particularly important role. Waterloo Region has always welcomed immigration. In the 2016 census, there were 119,335 immigrants living in Waterloo Region. That's almost a quarter of the region's total population and more people than the whole city of Waterloo. And this is only permanent immigration population. On top of this, we have temporary migrant populations that grow every year through international students, temporary foreign workers in our tech and other industries, and refugee claimants seeking protection. A growing number of these people will seek to stay permanently in Canada. At this size, the Immigration Partnership believes it is important to be intentional as a community about supporting this population's success. Are immigrants being welcomed? Are they settled? Are they working in meaningful jobs and growing successful businesses? Do they have feelings of belonging? And are they able to give back to the community? Through the Immigration Partnership, we've identified priorities and set community-level action plans to empower immigrants and refugees living in this community to succeed, which feed into the organization-level actions amongst all of our partners. As the regional and area municipalities, we ask you to consider how this factors into your planning and what plans are in place for ensuring adequate flow of new immigrant arrivals in Waterloo Region. Statistics Canada data shows that new international migration is the main driver of population growth in Ontario and in Waterloo Region. Canada needs new sources of talent to enter the labour force to maintain its high standard of living. The Conference Board of Canada reports that between 2018 and 2040, immigration will account for all of Canada's net growth in the labour force and 1/3 of the economic growth rate of the country. Statistics Canada reports that found that immigrant-owned firms are more likely to create jobs than firms owned by Canadians, and that on average, immigrants donate more to charity than Canadian-born residents. Other research has found that immigrants consume arts and culture at a higher rate than Canadian-born, and that immigration is a driver of arts and culture in Canada. In short, immigrants and refugees lift up our communities. Waterloo Region is impacted by all of this. While some immigrant and refugees settle and find belonging and success in Waterloo Region quickly, others struggle. Immigration is an increasingly important factor in ensuring that Waterloo Region's growth and the strengthening of our quality of life, community, social, and economic development. There is a pressing social and economic imperative for municipalities like Waterloo Region to attract, retain, and effectively integrate a robust immigrant and refugee population. While immigration is a federal mandate, it is communities like Waterloo Region that the successes and challenges of immigration play out. Municipalities across Canada are increasingly taking an international approach and a holistic view to immigration attraction, retention, and integration. I won't show them here, but if one takes a look at the Halifax Strategic Plan or the Hamilton Strategic Plan, very different communities, but they are very much paying attention to the importance of attracting, retaining, and integrating immigrants. We invite a wider involvement of staff across departments in our steering groups and strongly encourage council and staff to participate in events like our Regional Immigration Forum coming up this November. This forum will focus on where we'd like to be as a community on immigration in 10 years. We offer our engagement and support in city planning and service improvement processes. We also invite Regional Council to continue to act as a strong advocate on immigration matters and on behalf of immigrants and refugees in Waterloo Region with the federal and provincial governments so that everyone living in this region can thrive. These deeper relationships will provide the foundation of immigration knowledge and know-how that is needed for effective and intentional action to attract, retain, and integrate a robust immigration population that will help drive Waterloo Region into a very successful, prosperous future. I missed a diversion, I'm heading back, but another example is our local talent, local impact event with the Greater KW Chamber tomorrow to learn about immigrant talent and business and how it's building up Waterloo Region, and to help promote the immigration survey, which is running now, which you will hear more about. I thank you for having us here today. There's a number of us from the Immigration Partnership. Can I see a wave of hands? There we are. Thank you for having us all here today, and I'd be happy to answer any questions.
And we do have a couple. Councillor Foxton.
Thank you, and through the chair. I've had an interesting life and careers, and one of them was in special ed back in the early 1990s. And at that time in special ed, the stats came out that we were at zero population growth. And since then, we've been sustained by immigration. We are selective. Canada is selective and only gets a lot of the best of the best. But without immigration, we would have been in a huge decline. We would not have been able to move forward in industry, in entrepreneurship, or in housing or anything else. It had a huge impact on our population. In 2008, I get these wonderful stats that I love and I keep in my heart. We had 400,000 people retire in Ontario, and only 100,000 come into the workforce. Now, that is why I think also it played a part in our economy not crashing as much as it did in other countries. But what is sustaining us is immigration, and your statistics just prove that again. And we as a society have to be aware. I grew up in a family of 7, and I'm sure, well, maybe not a lot of you around here are as old as I am, had larger families, and today it's 1 or 2 per child, if any. And that, again, is declining our population growth. And what is foremost we all have to remember is we are all from immigrants. Thank you.
Thank you. I guess I want to invite you to speak a little more on that. There was a report today in the papers that you probably saw that showed the results of some national survey that said that the majority of Canadians feel that we're bringing in too many immigrants and refugees. And I think Councillor Foxton talked about why that's not the case, and I think you mentioned it, and you referred to that in a few of your notes. But do you want to, since you have the floor, since you have a mic, would you like to address that?
Well, I think I will add that when we had the influx of Syrians and 1,800 people, it really raised the awareness of immigration and refugees in this community. I think a lot of people had not really paid attention. And I think that's fabulous, the number of people who came forward to help with that. And that was a really good thing to do. I think what got lost in the message, and it's what we're talking about, is people do need to understand the economic imperative of this. This is not a good thing that we're doing in wanting to attract high-quality talent to our communities. We need to do this as a country. And I think that's the message that, and I feel like it's gotten a little mixed over the years that, it was a good thing with the refugees, but hey, let's slow it down. Two very separate conversations. And I think that's where we can use everyone's help. And I've certainly reached out to the City of Waterloo, the City of Kitchener, the region, that as we create our strategic plans, this is an important element.
Thank you. Another question from Chair Redmond.
Thank you, Chair Clark. One of the things that really impacted me yesterday was watching, over the past few weeks, all the Raptor fans that are talking about We the North and the fact that we look like a United Nations, and that's who Canada is and has been for a very long time, particularly in Toronto, but also in Waterloo region. And I'm just wondering if you can comment, you talk about attracting immigrants, and I know for a very long time the secondary migration of people choosing to immigrate to Canada, but settling within Canada, then being attracted to Waterloo region. Do you track those statistics at all?
It's very difficult for us to do so because of the availability of statistics. I always joke that IRCC is great in collecting them, but not in sharing them. So it is very hard for us to follow movement. But what I do know is that as a community, up until now, our focus, whether it's been at levels of government or through the immigration partnership, is the settle and belong. We've had no intentional attraction strategies. So people are coming here because we have a good reputation, we have excellent universities, it's a smaller, safer community. They're coming here as a choice, but we have not actively done attraction at most levels.
So if I'm just going to feed back to you what I'm hearing, that you're saying as we go forward with strategic plans, which most with Cambridge, Waterloo, Kitchener, the townships are doing, as well as the region, that we should be more intentional of incorporating strategies to attract immigrants?
Yes.
Okay, thank you.
I see no other questions, and we'll see you on Saturday.
Thank you very much. Sunshine, everyone.
Thank you. We are on to our consent agenda items. Do I have a request to remove any items from the consent agenda? Seeing none, do I have a motion to approve the items or receive them for information? Moved by Councillor Kiefer, seconded by Councillor Erb. All in favor? That's passed. We're on to the item 4.1, Rabies Prevention and Control Program update. That's information. I don't believe we have a presentation. Oh, that's one of the, so I'm sorry, that's a consent agenda item. All right, we do have a presentation on the harm reduction planning programs and services update, item 5.1.
I'd like to ask Karen Quigley-Hobbs to make some open remarks. Thank you. Through you, Madam Chair. Good afternoon, councillors. Before you today is an update on the harm reduction program for public health. As you are well aware, this is part of our public health mandate as outlined in the Ontario Public Health Standards and Protocol. And as such, the work is to be developed and implemented in collaboration with our community partners. So here in Waterloo Region, that is done with the Harm Reduction Coordinating Committee of the Waterloo Region Integrated Drug Strategy. In June of 2017, Council endorsed 4 report recommendations that would help to focus the work of the group. It included exploration of the feasibility of supervised injection services in Waterloo Region, work with healthcare providers to improve knowledge of harm reduction and capacity to serve individuals who use substances, identification and work with new community partners to provide harm reduction services, and the exploration of opportunities and funding to expand outreach and mobile initiatives in the community to better reach priority populations. Today, the program manager, Grace Birmingham, is here to present a report on the progress of the work that will also include our needle syringe program and naloxone distribution. She is joined by Jeremy Turner, who is our NSP or needle syringe program coordinator. Thanks, Grace.
Thanks, Karen. Good afternoon, Councillor or Chair Clark and members of Community Services Committee. This feels really loud. So as Karen mentioned, the Board of Health is mandated by the Ministry of Health and Long-Term Care to collaborate with healthcare partners to ensure access to harm reduction programs. As you know, in Waterloo Region, harm reduction is one pillar of a comprehensive integrated drug strategy, which also includes prevention, recovery and rehabilitation, and justice and enforcement. Oops. There we go. So today I will provide an update on harm reduction work underway and will highlight specifically the needle syringe program, the Ontario naloxone program, the needle syringe disposal program, and the work of the Harm Reduction Coordinating Committee. So in Ontario, needle syringe programs have been available since 1989 and in Waterloo Region since 1995. Extensive evidence demonstrates the effectiveness of harm reduction supply programs to prevent the spread of bloodborne infections such as HIV, hepatitis C, and hepatitis B. Through the needle syringe program, Region of Waterloo Public Health and its community partners offer harm reduction supply distribution programs and services that meet the criteria set out in the Substance Use Prevention and Harm Reduction Guidelines. And the work with respect to this program includes provision of sterile drug use equipment, provision of safe disposal containers, client-centered counseling and referrals, and overdose prevention services. I will mention that services offered by partners are delivered in settings that support a client-centered approach, bringing services to where people are using low-barrier, outreach-based approaches. In order to become a needle syringe program partner, staff involved are trained by public health and are offered support to make sure that programs are offered in accordance with the guideline. Partners are required to provide program statistics on key program indicators, including age and gender of clients, repeat versus new clients, number of supplies distributed, and other information such as referrals. This year, the Ontario Harm Reduction Database, which is a new provincial information system, will be implemented. The database is a secure web-based application and will allow for better monitoring and reporting of client utilization of harm reduction programs across the province. In 2018, Public Health locally engaged partners in electronic collection and submission of program statistics with attention on data consistency, completeness, and quality. And as such, we are in a very good position to support the onboarding of partners to the Ontario Harm Reduction Database, which will further build on the work around data quality in particular. So in 2018, we saw just under 20,000 in terms of total client interactions, and of these interactions, 84% were return clients. Approximately 65% of clients identified as male and 32% identified as female, and the average age of clients was about 38, which is fairly consistent with past years. So then moving on to the Ontario naloxone program. As you know, naloxone is a life-saving medication that temporarily reverses the effects of an opioid overdose and is one part of a larger harm reduction strategy that aims to reduce deaths from opioid overdose. Locally, The naloxone distribution program was launched in September of 2017 by the Region of Waterloo Public Health and as required by the Ministry of Health and Long-Term Care as part of their provincial opioid crisis response. The purpose of the program really is to get naloxone into the hands of those who use substances and who are at risk of overdose. So, with respect to the Ontario Naloxone Program, Region of Waterloo partners with various agencies to support distribution from a total of 19 sites across the region, including organizations such as shelters, community health centres, supportive housing, and harm reduction agencies. And I'm pleased to share that as of last week, all 3 hospitals in the region are naloxone distribution partners. Naloxone is also available at the 3 Ontario Addiction Treatment Centres and the Towards Recovery Clinic in the region, as well as Sanguine Health Centre. However, these programs are separate from those operated through public health and are supported directly through the Ministry of Health and Long-Term Care. However, we do get their statistics. They do send them to us. In June 2016, pharmacies in Ontario began distribution of naloxone kits under the Ontario Naloxone Program for Pharmacies. In May 2018, the Ministry of Health and Long-Term Care removed the barrier of requiring an Ontario Health Insurance Plan card in order to receive a naloxone kit at any distribution point across Ontario, including pharmacies. So through this program, all individuals in Ontario can receive a free naloxone kit from participating in pharmacies without a prescription. Public health units are also required to support distribution of naloxone kits to first responders through the First Responder Program. And this is so that they can administer naloxone in situations where they are suspecting an opioid overdose. Region of Waterloo Public Health have partnerships with the St. John Ambulance, all 3 branches in the region, as well as the Waterloo Region Police Service. Public health staff continue to assess eligibility and support for additional naloxone partners as appropriate, so that work continues. So in terms of statistics around naloxone distribution within the region, in 2018, approximately or just over 12,000 naloxone kits were distributed across the region through the various places. Just under 2,000 were distributed by public health and its partners. Just under 5,000 were distributed through the OATC's Towards Recovery Clinic and Sanguine Health Centre, and 5,300 were distributed by pharmacies. Individuals who receive sterile injection supplies through the needle syringe program are also provided with disposal containers in various sizes to support safe needle disposal. Through a survey of clients in 2017, findings show that most clients report that they not only return their used supplies, but they are also concerned about improper disposal in our community. To support appropriate disposal, public health monitors the numbers of needles being distributed and returned through needle syringe programs. Public Health also chairs the Harm Reduction Disposal Work Group, which is comprised of members of local municipalities, the Waterloo Region Police Service, regional bylaw, and harm reduction agencies, in addition to the Grand River Conservation Authority. And through this group, disposal needs in Waterloo Region are identified and prioritized for action. In 2017, an assessment of current disposal options and local data informed 5 recommendations for implementation, and work related to all 5 of these recommendations have been implemented. And I'll just focus on a few of those recommendations now. 5 outdoor disposal kiosks were installed at locations across Waterloo Region in 2018. Use of the kiosks is monitored regularly and continues to increase. Due to the success of the kiosks, 9 additional were purchased, and additional locations for where these kiosks will be located are now being explored by the working group. In addition, the WINS, or Working to Improve Neighbourhood Safety pilot project, which has been described at previous meetings, was initiated to proactively to explore the role of proactive needle recovery within the community. I am pleased to share that a final evaluation report has been completed and has indicated a number of positive outcomes, as well as a few areas of improvement. With respect to disposal, communication resources continue to be an important part of a comprehensive strategy. And again, in partnership with the Harm Reduction Disposal Work Group, Public Health developed a number of resources to encourage appropriate sharps disposal and instruct members of the public on what to do if they find a needle. As part of this, posters were developed geared towards parents, teachers, and children on what to do if a needle is found. In 2018, posters were shared with school boards along with key messages for teaching staff and parents. So this is the poster that we distributed, and this is an adaptation from a poster that was created in North Bay. So as mentioned, public health and its partners continue to work to enhance disposal options and consider new priorities to address emerging issues. Appropriate disposal through the needle syringe program has increased over the last 2 years. As you can see from the graphs here, in 2017, we had about a 46% rate of needles returned through our needle syringe program. And in 2018, we saw that increase to 72%. It is important to note, however, that while there are a variety of safe sharps disposal options supported by public health and our partners through the needle syringe program, there are a number of other options for appropriate sharps disposal in our community, including places like restaurants, municipal buildings, pharmacies, and a few others. So therefore, our return rate that we can report is an underestimate of the actual rate of proper disposal in our community. So the Harm Reduction Coordinating Committee, this is a group that continues to play a pivotal role in identifying and prioritizing areas for action based on the recommendations from the Waterloo Region Integrated Drug Strategy. There are 23 that relate to harm reduction, as well as any emerging issues as informed by local data. In June 2017, Public Health and Community Partners provided a report to Community Services Committee seeking endorsement for 4 recommendations to enhance harm reduction services. That included, at the time, to explore the feasibility of supervised injection services in Waterloo Region, to work with healthcare providers to improve knowledge of harm reduction and capacity to serve individuals who use substances, to identify and work with new partners to provide harm reduction services, and to explore opportunities and funding to expand outreach mobile initiatives in the community, such as peer programs, to better reach priority populations. Since then, the members of the Harm Reduction Coordinating Committee have worked to support action across these priorities. So in terms of the future and the future of this work, the opioid situation has been marked by rising numbers of addiction and overdose, which in turn has increased demand on harm reduction services across the region. Needle syringe programs continue to experience demand, not only for injection equipment, but also for naloxone kits and safer inhalation supplies. Ongoing monitoring of data remains an important source of information for priority setting and decision-making to guide ongoing improvements to harm reduction programs and services. Recent improvements to the Waterloo Region Overdose Bulletin provide important information to public health, community partners, and other stakeholders, and you can see that on the slide here. The bulletins also, they provide summarized local data for each quarter, and there are some data additions within this new iteration, and that includes data from the Office of the Provincial Coroner, as well as integration of other data that has become recently available. The bulletins themselves, they're created by Public Health and are available on the RIDS website, and I believe there's a link to the latest bulletin in your package. So members of the Harm Reduction Coordinating Committee are currently engaged in strategic planning to identify work priorities for the next 3 years. To support the planning process, partners will consider harm reduction work completed in the region over the last 3 years, as well as emerging trends as supported by the local data. Priorities for action will be shared for review and approval by the Waterloo Region Integrated Drug Strategy Steering Committee and will be shared as an update to Community Services Committee at a future meeting. And I thank you for your time this morning.
Hold on, Grace. Not surprisingly, there are quite a few questions. Oh, and more appearing every moment while I try to get my mouse to work. It's not wanting to respond. Councillor Jowett.
Thank you, through the chair. So very encouraging numbers on the exchange programming with the upwards of 70% retrieval. That's some good things to see. I guess what I'm kind of looking at when I started to see the report, I saw that we have like for example, a provider who provides needles in one area and maybe naloxone in another. And then, for example, on page 40, we have Sanguine distributing needles. But on page 42, they're not distributing naloxone, but through another way, maybe, so are they somebody who's provincially funded for naloxone and not through the region?
Yeah, so the Sanguine actually, the way the province rolled out the naloxone distribution program is they began with Hep C organizations, Sanguine being one of those. And so by virtue of by that, they began their naloxone distribution earlier. But I will say that the naloxone distribution and the needle syringe program, in terms of practical service delivery, it goes hand in hand. So they do it at the same time.
That makes sense to me too, Grace. But so what I want to ask here is that I've heard about times when they feel like there's duplication of effort in some of the service providers, right? So so that I'm trying to understand. It's easy to see how that could happen if you're getting some of your sourcing from the province and some from the region, et cetera. And so I understand Sanguine to be an organization that has a van and they tend to want to go out to those more remote areas. Is there something we're doing to ensure that that particular strategic initiative is really happening? Because I feel like the van has been a bit of a bone of contention sometimes around town, because they keep saying, why are they in town when we already have these distribution places and we have these folks out on the river and in the peripheral that aren't being reached as easily. So is there a way that we can sort of ensure that that strategy is actually happening?
Through you, Chair. With harm reduction programs, what we know is that there are some people who will access services in one location, and there are others who will access services through another location. With this type of service and this type of clientele, trust is really important. And so you may have, a public health clinic that's providing services where clients are interested in going there, but they may not everybody will. And what we discover is that different agencies are seeing different populations. And so, for example, we know Aqua, who delivers some services, they deliver services actually across the region. They tend to be more successful in reaching female clients. With respect to your question with Sanguine and ensuring access to different populations, we do think that by having a number of different organizations with a role in this, we are increasing access and they are accessing different populations.
Okay, and just, I won't belabor it, but I will tell you that those actual sites have been frustrated and actually told the van to stop coming here. We're distributing our own. And so all I'm trying to say is there's got to be a better way for us to monitor that there's less duplication of effort, and certainly that there's more strategic uses of the resources, because a mobile van is quite strategic in being able to hit the peripheral areas. And just ensuring if we can do that, we're also reducing the amount of waste, which I think is frustrating a lot of folks. No matter how important it is, to have the needles to prevent the blood-borne diseases, and I think people are becoming very much aware of that. It's just if there was a way to reduce the waste, it might sort of further combat some of the challenges we've had around it. So, okay.
Sorry. Councillor Jaworski.
Thank you, through the chair. I was very happy to see that the Sharps disposal program is working so well. I heard the results here in Waterloo. I was actually surprised until I read this report. I didn't realize 40% of the Sharps collections are in uptown Waterloo, and just based on sites. And so very happy with that. I know we had a lot of problems on our Laurel Trail about 3-4 years ago, and then through the addition of the Sharps collection site, we had a lot of complaints about needles being disposed there. I get virtually no complaints anymore, and I was shocked when I heard the results of how many are collected on a monthly basis. I think it's the order of hundreds or more. And so seeing that the 9 additional kiosks are going to be purchased and put through, is there anything required for that? Because I can just, I'm a big advocate of these Sharps disposal things. People don't even notice them. They walk the trail all the time, but people do use them because they're in need and addicted and just want to do the right thing.
Yeah. Through you, Chair. So the 9 kiosks are purchased right now, so we do have them. It's a matter of working with the disposal work group to decide on what are the most strategic locations for the kiosks, and then moving ahead with installation. There's a fee with this in association, not only with the purchase of the bins, but also with the servicing of the bins, and so that's something to consider as well.
Well, I do think they're certainly wonderful for the community, and a lot of people have appreciated the fact that everything is cleaned up, but there's still a place for people who are in need.
Councillor Lorenz.
Thank you, Madam Chair. Thank you for the update, Grace. It's quite interesting, and I'm quite surprised about the syringe exchange program as well. Does this include cleanup, people that have gone out and picked up needles off the trails, or is this just strictly users that are throwing it back into the disposable cans?
Through you, Chair. So it would be difficult to say. So we track what comes back through the kiosks. We also track what comes back through our clinics. And so I would suggest that it's likely a combination of the two. That being said, materials that are provided back through our clinics or through the needle syringe programs, whether it be Sanguine or Aqua or Public Health, those are typically from people who have used the supplies themselves.
And do you think that the new kiosks that we put in are having a positive impact?
So through you, Chair, the kiosks, I think, have made an incredible difference in our community with respect to proper disposal. When we began the installation of the kiosks a couple of years ago, we knew that communication, so awareness that the kiosks exist, as well as the stigma around using the kiosks would need to be addressed. And so through our partners, we continue to support them in providing messages to clients who would access those kiosks to let them know that, in a way to try to flip the script around, you are doing a great deed when you use these kiosks rather than feeling worried about being seen using the kiosks. So that's a difficult message to bring across to folks, but we think we're seeing some success because the bins are being used more and more.
Have you discussed at all expanding that program? I know there's some shortcomings in doing that, but in the same token, if it's that successful, maybe there are a few other locations that we could be looking at.
Yeah, through you, Chair, we do have 9 additional kiosks that we have waiting to be installed, and we're beginning to explore where those could go.
Okay, and I was also surprised, like Councillor Jaworski, about the numbers in Waterloo, but our study has identified that there really is not a problem in Waterloo. That's why we've never looked at doing anything, as opposed to down in Kitchener and Cambridge. Right? Do you have any? Why is that?
Through you, Chair. So we have a kiosk that is actually located outside of the 99 Regina Street building. So that is one location that we know people who are using substances, they come in and out of the building. So again, it's in a discreet place where people who are entering the building have access.
They could be coming from anywhere in the region, right?
They would come from anywhere in the region. It doesn't necessarily mean they're from Waterloo. And again, the Pepler kiosk is on a trail that is a route of traffic through the region. And we suspect that that's another reason why it's well used.
Okay, and it mentions the provincial and federal applications. Do you have any updated status on where we're at with both of those?
Through you, Madam Chair, all of the applications are in, as you say. Now we are waiting for response. We plan to bring an update on the status of CTS and all of the associated applications to Council next week.
Okay, thank you.
Councillor Galloway.
Thank you, Madam Chair. Grace, a lot of good information in the report and certainly some success on the harm reduction pillar. I'm not sure. I have a question, maybe more of a comment. Maybe you or Karen or Dr. Wong want to comment. And that is, we have 4 pillars. Harm reduction is but one pillar, but it's the one that gets all the attention. And last night, Councillor Banovic and I were at an event where Chair Redmond was the guest speaker. And questions from the audience, one of the questions was about CTS and why all the emphasis on CTS and not enough emphasis on enforcement. And Chair Redmond capably answered that question. But this was from an individual who is well respected and I have a lot of time for it. I did talk to him afterwards. But it is a common perception with the opioid crisis that we're dealing with here locally, of course, and across the country, that all we're doing is harm reduction work. And we're doing so much more, of course, in the other 3 pillars with all the 98 recommendations that came out of the integrated drug strategy. So My question isn't so much the details or it's more of a comment. How can we do more to show the community that there's 3 other pillars? They're all being actively worked on. They're all being, there's strategies, and there's enforcement strategies, there's education strategies, there's rehabilitation strategies. I know that the harm reduction stuff is the stuff that the media likes. That's the stuff that gets the attention, and that's why the community believes it's the only thing that we're essentially working on. And this was evidence last night from this individual who is a well-informed, really good, solid citizen who just didn't think there was any enforcement going on. And but yet we know there's a number of strategies. So I don't know if that's a question, a comment, or just what, but it's part of the dilemma we have with the communications on this particular issue.
We need to start planting questions in the audience about other things. Sorry, go ahead.
I would agree that we do need to focus on communicating more clearly and more widely with regards to the other pillars of the integrated drug strategy. A starting point is our recent video that is more integrated and comprehensive in terms of trying to cover the whole spectrum of services as opposed to harm reduction. I think in part we receive a lot of media attention because by the virtue of harm reduction being in a mandate of public health, we are before you as the Board of Health on a number of occasions reporting on our programs and services and the initiatives that we have underway. So I think your point's well taken. Anything more we can do to enhance communications in those areas, we will begin to do, and I know that's a priority of the Special Committee for Opioid Response, to try and be very clear with the community and about all of the different initiatives that are underway that go beyond CTS and beyond needle syringe programs.
Thank you.
If I could just quickly add, so we recognize that is a challenge, as Karen mentioned, because we were given the mandate from the province to do work in the harm reduction pillar. I think that's one of the reasons it's added to the greater prominence of that topic coming back to Regional Council. That said, we are helping to support the community's opioid response overall through the special committee, as Karen mentioned. And one of the things that we are planning to do is to have each of those pillars come to Regional Council to present updates on the work in those pillars, and we think that will help. So, for example, this fall we're planning for the treatment pillar to come and present to Council on the work that they've been doing.
I think that along with all of the announcements that came out provincially and federally over the last year or so around improved harm reduction services in CTS, there were just as many announcements around new treatment opportunities and new funding for those sorts of services, but they didn't come to us because they were coming to the LIN board, I assume. Councillor McGarry.
Thank you, and some of my questions have been answered already, but I just had a couple really. Music to my ears for more communication. As you know, my community is coming out in force to protest anything to do with a consumption and treatment site anywhere in Cambridge tomorrow night at a protest when it's coming to council what our process will be to look for a consumption and treatment site. And it appears to me that the individuals that are protesting are against the consumption services and forget that there's a big T for treatment in the CTS sites. I know that there's been a lot of work by individuals in Cambridge to look for other treatment options, and I'm happy that they are doing that. What I am going to be asking them tomorrow night as what they are doing in looking at other avenues for funding, and are they going to the provincial government, who really holds mandate on anything health-related, while we're doing that. But one of the things that continues to come up from the community is the number of outlets for syringes and sterile injection supplies from the number of different sites, from the shelter to the food bank to a number of other community organizations. And Councillor Jowett also brought up the fact that when the Sanguine Health van then comes around, because it's a mobile van, they're not there with the supplies to help have those syringes returned at a later date. So I guess in this very complex world, what I'm asking is it usual to have shelter organizations distribute syringes? Is it fairly usual for food bank organizations to distribute syringes? And if indeed we have a mobile van, what further strategies can we have in order to help return the syringes to an appropriate receptacle rather than on the streets, the riversides, and our parks?
Through you, Madam Chair. Every region provides needle syringe programs in different ways. Often that work happens through different harm reduction related agencies such as Sanguine Health Centre or Aqua, which happen to be two of our biggest partners with respect to supply distribution. In our region and through our partnerships with the Harm Reduction Coordinating Committee, different agencies have reached out over time to suggest that it would be helpful for them to be able to have be a partner in the needle syringe distribution program, not only because it keeps their clients safe and allows them to access sterile equipment, but it also provides a conduit for used supplies to come back, so they won't be, have the issues of improperly disposed of needles in their properties and in their bathrooms. And so every agency has both arms, including the Sanguine van. So the Sanguine van does distribute syringes as well as food and other basic needs items, but they also accept used supplies back through that model. So the way that the program locally has evolved with respect to the demand and what agencies feel will best respond to the issues that they're seeing.
Thank you. And if I can have a follow-up, Madam Chair? And the other question I would have is, what advice or what suggestions would you have for community groups who are, certainly researching other treatment programs, looking at asking for potential pilot projects in their communities in today's climate and understanding so many changes that are happening from the provincial government at the moment? In today's world, what is the best way for community groups to move forward with asking who about how to get other pilot projects regarding treatment in their communities?
Through you, Madam Chair. I think one of the key things that the government, all governments in the past few years have looked to is a collaboration among community members and communities at large. So I would suggest that what they would look for, and we can see this through the provincial government's response to CTS, is that they are looking for networks and for not isolated responses to issues, but things that are integrated together that can serve clients on a continuum. So depending on where they're at in terms of their journey, what I would recommend is that groups work together with their partners that are established in the community to generate a solution that is comprehensive and collaborative.
Thank you.
In addition, in our region, through the integrated drug strategy, we have a treatment pillar where we have the various partners that are the key partners in providing service and or funding them, such as House of Friendship, the LIN, other providers. So, if community groups would like to provide some suggestions to this group, whom I know are also aware of the evidence and staying on top of it, we would be happy to facilitate that information going to that pillar. They could provide it to us, for example, and we could direct it to that pillar and the co-chairs of that pillar.
Chair Redmond.
Thank you, Madam Chair. I just want to pick up on some of the comments that Councillor Galloway and others have made, and that's really to say that the reason that we're looking at and having a conversation about treatment sites is because it was an initiative that was offered by the provincial government. It shouldn't be seen as the only solution, and people should lean into looking at other solutions. But the reality is we need it all, and it's a pan-region, it's a pan-provincial, it's a national health emergency. And I think Councillor Lawrence was somewhat tongue-in-cheek when he was talking about the fact that there was a syringe return in Waterloo. We know that there are people dying across the region. What's the number, Grace? Is it 11 people that have died?
In May.
In May? It's not going to go away anytime soon, and it's an integrated drug strategy, and I'm going to remind Council, I think I've said this one other time, when I was with an outreach worker when Elizabeth and Helen and a few of us were doing a tour around St. John's Kitchen and looking at some of the tents that had sprung up. And I asked the outreach worker, what do we have to do for whatever comes after fentanyl and carfentanil? And the drug strategy doesn't just say fentanyl or opioids, it's a drug strategy. This is the kind of pressure that's going to continue on communities into the future. And the outreach worker said to me, do exactly what you're doing. Have an integrated approach where everybody comes to the table, because nobody has one answer. And public health is trying to facilitate those answers. And the fact that some communities, and I understand that it's a very threatening issue to look at how we're going to grapple with this, but communities are stepping up. Kitchener stepped up. And the people in Cambridge care about their neighbors too, and they have to see this as one of the tools that's been offered. We're considering this because it's something the province said that they would help fund, but it doesn't mean that we won't consider other options. And I think the integrated approach is the one that's going to help find our way through this opioid crisis and help hopefully give us shock absorbers for whatever comes after it.
I actually have one technical question. Just in terms of the numbers of discrete individuals we serve, you report 19,000 odd client visits, but do we have an estimate of how many individuals that is?
Unique individuals. It's likely, just given the number of new, I'm going to say it's fairly in line with what we saw when we did the substance use study a couple of years ago, so between 3,000 and 4,000.
3,000 and 4,000.
I'd say, but we can get you that number for, the exact number.
Thank you. I see no other questions. Thank you very much. And we'll see you next week. We have another staff presentation on the immigration fact sheet, and I probably should have bounced that one up to after our initial delegation, but I missed that. Sorry for making you wait, Tara. Tara and I had coffee yesterday, so I got to hear all this information individually.
All right.
Go ahead.
So I'm going to pull you all back now to the conversation that we started a little while ago. Good afternoon, Chair Clark, Chair Redmond, Regional Councillors. Thank you for having me here today. I am here speaking to a joint report by the Immigration Partnership and Public Health and Emergency Services on the new Waterloo Region immigration profile. My colleagues, also Ariane Folkama and Dan Vandebelt from Public Health and the Immigration Partnership, are here with me today. They have done the lion's share of the work on this profile. They're like really awesome data people, and if you have deep questions on the data, I'm going to be calling on them to help in responding to that. There's a presentation. Okay. This profile that we have put together with Public Health builds on the immigration information that was contained in the region's 2016 Census Bulletin on mobility, migration, and immigration, and it is intended to provide a more fulsome look at the state of immigration in the region. It is intended to inform population growth strategies and to assist with program planning and service delivery for the region of Waterloo, for the area municipalities, and for other organizations across Waterloo Region. We are here today to highlight a selection of the key data points for regional and community planning. And I'm just going to note, as you're looking at some of the tables from the full fact sheets, this was intended to be under the joint logos of the Immigration Partnership and Public Health, and I'm just noticing that the Public Health one didn't get on, so I apologize to my colleagues and, really want to emphasize this was a strong collaboration. So the first slide looks at permanent resident landings in Waterloo Region by admission category from 2008 to 2017. As my colleague Lucia from the Multicultural Center mentioned earlier, there were 119,337 immigrants living in Waterloo Region in 2016, more than the city of Waterloo and almost as large as the city of Cambridge. Between 2008 and 2017, a total of 28,675 new permanent residents landed here in Waterloo Region. Arrivals ranged between around 2,400 and 3,800 people per year, or roughly between 200 and 320 new residents across the region in any month. Among the four main immigration categories in Canada, 40% of all of the new permanent residents coming into Waterloo Region came through the economic class category. 33% came as sponsored family members, and 26% came as refugees into Waterloo Region. Compared to the data 5 years ago, the last time the census was done, Waterloo Region experienced a 15% increase in the number of permanent resident arrivals. Landings in Kitchener grew, while landings in the city of Waterloo stayed the same, and landings in the city of Cambridge declined. Among the immigration categories, refugee landings increased the most as a result of the Syrian Resettlement Initiative. We also know from the Census Bulletin that was done earlier that the immigrant population growth rate in the townships generally exceeded that of the cities in the last 10 years, in particular in Woolwich, which experienced an over 80% increase in the immigrant population. These numbers do not capture the temporary residents living in Waterloo Region. Data that we have been able to access from between 2012 and 2017 shows that the number of temporary resident permits issued each year in Waterloo Region has increased significantly. 41,595 temporary residence permits were issued in Waterloo Region in those 6 years. Many permits are multi-year, so the cumulative number of temporary residents in Waterloo Region in any year would be higher than what you're seeing on the graph. The greatest increase in the temporary population in the region has been among international students. In 2012, there were just over 1,000 international student permits issued in the region, whereas in 2017, that number was over 9,500. Also missing from this data are refugee claimants, people who come to claim asylum from within Canada rather than being resettled from abroad already with that status. Between 2011 and 2013, Immigration, Refugees and Citizenship Canada told us that there was an average of 80 refugee claimants in Waterloo Region each year making their claim for asylum. In 2018, the Mennonite Coalition for Refugee Supports, which is a local organization that provides support to claimants, told us that they saw new claims that year representing 630 people. That's a 90% increase from 5 years earlier. And they estimate that they see only about half of all of the refugee claimants in this community. This data is important because temporary migrants are increasingly transitioning to permanent residency and eventually citizenship in Canada. They outnumber new permanent immigrants in a given year and the number of new residents from other provinces or communities within Ontario. Permanent migration to Canada is growing from within the country, which has implications for population attraction and retention strategies. I'm going to come back to the question around secondary migration that was posed earlier. A certain level of movement of immigrants from their first community of landing in Canada is normal. The data that we have been able to find through a lot of digging, I have to say, it's very hard to find, shows that Waterloo Region gains population-wise from immigrant retention, as well as the secondary migration of permanent residents who have moved here from their first community of landing in Canada. Among permanent residents who arrived in Waterloo Region in 2010, is this the right? Yes. Approximately 5 years later, we had experienced a net migration increase of 21%. That is, more people are moving here than are leaving who arrive with a permanent resident status. When we look into information on the sources of population growth in Waterloo Region, net immigration contributes significantly. In 2017 and 2018, 32% of population growth in the region was due to immigration. Together with intra-provincial migration, this was the highest source of population growth. And in recent years, we have seen in the data that immigration has now surpassed natural increase as a source of population growth in Waterloo Region. The housing and household patterns of immigrants are different from those of the Canadian-born population. Recent immigrants and established immigrants are twice as likely to live in multi-generational households, for example. Recent immigrants are also much less likely to live alone and more likely to live with others. The neighborhoods with the highest proportions of recent immigrants were in the downtown Kitchener neighborhoods of Victoria Hills, Cherry Park, KW Hospital, and Vanier, Rockaway, followed by the City of Waterloo neighborhoods of West Waterloo and Columbia Lakeshore. Some of these patterns have likely been influenced by the Syrian refugee housing patterns. When we look at the languages and the countries of origin of immigrants who are coming into the community, these are also changing from historical patterns. In the latest census, Arabic was the most common mother tongue language of recent immigrants, followed by English and Mandarin. The neighborhoods of Wellesley Rural North and Woolwich Rural North have the highest proportion of residents with a non-official home language due to the large number of Low German Mennonite residents. And this is a mix of immigration, new immigrants and longer established folks in the community. Other neighborhoods in the region that have higher proportions of individuals with non-official home languages are sprinkled throughout Waterloo, Kitchener, and Cambridge. And these tend to align with the residential patterns of recent and semi-recent immigrants into the region. And in 2016, the data shows us that there were approximately 9,300 people living in Waterloo Region without a working knowledge of either English or French, and that most often those people were speakers of Portuguese, Arabic, and Mandarin. And this speaks to a lot of the work that we're doing around access to services and language as a barrier to services and the importance of interpretation at points of entry to services in this community for people who do not speak any English at all or who have very limited access. Looking in the profile at the data on employment, education, and income, I think this is data that shows great potential amongst the immigrant population in this community, and particularly the recent immigrant population. As this table shows, which is pretty hard to see on this screen, recent immigrants have a higher level of educational attainment than either established immigrants or the Canadian-born population in Waterloo Region. And yet, in 2016, recent immigrants were twice as likely as both the established immigrant and Canadian-born population to be unemployed. Among university-educated, racialized immigrants, unemployment rates were more than twice as high as the racialized and non-racialized Canadian-born population. And when comparing the education and occupational information that is contained in the profile, the data seems to show a level of underemployment or de-skilling of recent immigrants in the community, which speaks to potential for further contributions to the economic growth of the community. In 2015, the median employment income for recent immigrants in the region was estimated to be 31% lower than that of the region as a whole, and immigrants required approximately 20 years of residence to reach the regional median income values. This is unchanged from the last census period. And we also see in the data that recent immigrants are more likely, significantly more likely to live below the market basket measure than either established immigrants or the Canadian-born population, so more likely to live in poverty. Concerning housing, the proportion of renters amongst recent immigrants is more than double the Canadian-born population, and the proportion of recent immigrants living in housing that is categorized as either unsuitable or unaffordable is significantly higher than the Canadian-born population. As we go out through the immigration partnership and we engage with employers across this region and we hear of their struggles to find qualified talent, the immigrant population presents one very tangible way in addressing their needs, and bridging immigrants into more meaningful work earlier in their journey in this community would also address their income disparities. And that's something that we're talking about around the immigration partnership, and I think has implications for economic development efforts in the community. When we look at the social determinants of health and health outcomes, immigrants arriving in the last 10 years in Waterloo Region report similar levels of satisfaction with life overall and a strong sense of belonging at the same level as the Canadian-born population. And yet there are challenges. For example, in 2018, 21% of recent immigrants arriving in the last year reported experiences of discrimination compared to lower levels amongst longer established immigrants in the community and Canadian-born residents through some of the survey work that was done through the Canadian Index of Wellbeing and Wellbeing Waterloo Region. Census data also shows us that semi-recent immigrants are less likely to have access to a regular healthcare provider in Waterloo Region than others. Research on the physical health demonstrates that immigrants tend to be healthier than non-immigrants when they arrive in Waterloo Region and in Canada, but that the longer they live in the country, the more their health declines. This is partly due to the rigorous health screening that people go through their immigration process, which means they arrive very healthy in the country, but that once they get here, things like income levels, language proficiency, the circumstances of their arrival, their original location in the country, factors like discrimination, health literacy, their ability to integrate, all kind of bring their health status down. And this has implications, I think, for public health and other planning in the community. So to summarize what I think are a few key takeaways from there's a lot more data in the profile, and I hope that you'll all take some time to go and look at it. As I look at the data, some of my key takeaways are this. There are a significant number of immigrants coming into Waterloo Region each year, and an increasing number of temporary residents. Waterloo Region gains population-wise from secondary migration. More immigrants come here than leave the community. Immigration has surpassed natural increase as a source of population growth. And so as we look at, the future growth of the region, that focus on immigration is really important. The languages and countries of origin of new immigrants are different than the historical patterns. Waterloo Region is a really multilingual and multi-ethnic community. Immigrants have different housing patterns and needs compared to others in this region, which has implications for housing development. They tend to be younger and more educated, but they also experience employment and income gaps, which shows through dedicated work, there's growth potential there. Immigrants also arrive very healthy, but discrimination and other factors have negative impacts on their health. This immigration profile contains information that is useful across Waterloo Region's area municipalities and the program departments. It points to incredible potential for Waterloo Region from a population growth perspective and a community and economic growth development perspective. It also shows that there are still many things that we can do as a community and as municipalities to ensure that every newcomer to Waterloo Region is empowered to succeed and fully contribute to Waterloo Region's excellent quality of life. we, myself and my colleagues, would be happy to take any questions that you have. And thank you once again for having us.
Thank you, Tara. I don't have any questions. No, I have no questions. Thank you for your excellent presentation and for your patience. All right, we're on to our community services reports. Are we going to do a musical chairs? We don't have, the next item is the employment services transformation. There is no presentation on this, but there is a recommendation, and that's moved by Councillor Galloway. Do I have a seconder? Seconded by Councillor Jowett. All in favor? That passes. Similarly, the revised childcare allocations and service agreement, no presentation, no comments, but a recommendation moved by Councillor Foxton, seconded by Councillor Armstrong. All in favor? And that passes. On to information and correspondence. I don't believe there was any. Our council inquiries and requests for tracking information list. I did have just sort of one question or comment about that. I think the excellent report today gave us some information around needle disposal, but there seems to be a budgetary element in the request. I'm wondering, is this something that will come with budget, or?
I think it's possible that when that request was made, it was in the context of understanding, the budgetary implications of the harm reduction program, and I think it is covered in the report.
Okay.
Yeah.
I know that one of the things that's mentioned, if not in this report, and I'm maybe blurring them in my mind, but the fact that the outreach program has been quite successful, and we would like to be able to continue that, I'm presuming. So I think that's something we will be looking at.
If you're speaking about the Cambridge program,
Yes.
the program, yes. So yes, they are in the process of looking for additional funds for that. So we can definitely report back on whether we've been able to find them.
Okay, thank you. All right. Is there any other business? Seeing no any other business, our next meeting is Tuesday, August 13th, which I hope is a long way away. Do I have a motion to go into closed? Councillor Laurent, seconded by... We didn't finish it. Yeah, we did do a couple of the items for closed, but we have one more item to address. Okay, so sorry. I did get a motion, and seconded by Councillor McGarry. All in favor? We're in closed. Thank you. A motion to adjourn. Councillor Redmond. Adjourned.